Great. Good afternoon, everyone. Welcome to the September KPQC Learning Forum. We have a lot to go over today. I'm going to turn it over to Tara or Jill or Carrie to get us started. If you have any questions, feel free to enter them in the chat and I'll be watching that. Take it away.
Okay. Well, Tara, Carrie, Jill. The good news is that all three of us are present and definitely can jump in. I told them that I would do the slides today. So, but just know that you always have all three of us to be present and supportive. You guys, it's September, almost October actually, and we have some exciting updates to send out to the membership before we get started on our presentation. So next slide, Tiffany. Biggest news coming up next month, October 20th, is the massive statewide conference. Everybody who is on this call, and I would just tell you, if you are in Kansas, Missouri, Oklahoma, everybody is welcome to this exciting conference. As you can tell, if you look at the speaker list alone, I'm certainly listed, but that's not what I'm speaking about. It's the other folks I can't wait to hear. So I'm going with excitement to listen, but our topics are also phenomenal. And our goal with this was to bring together leaders in the state under all titles, all goals, to get everybody under one roof and talk about how we're making change in maternal health, specific around perinatal morbidity and mortality fixes. So we are excited. Please scan the QR code there, register if you haven't already. And then we really want you to share it out. Colleagues of every shape and size, and every institution and or community members. We would love everybody in attendance. Next slide. And then also big news is that thanks to our great leader, Karen Brayman, who's the head of the Kansas Hospital Association, we decided that we were going to finish up the 4th trimester initiative, which again is associated to the national bundle regarding postpartum transitions. When we decided to stop enrollment in October, Karen sent out a last call, and it worked. It worked great. So these are the 5 hospitals that have now joined 4th trimester initiative. So we welcome Labette, Smith County, Mitchell County, Salina Regional, and McPherson to our 4th trimester family. Next slide, Tiffany. And this is the part that I wanted to show you. You guys, if you look at the stars and you look at where births are happening in Kansas, look at the rural presentation, look at the urban presentation there. Look at the fact that we have finally, 2.5 years later, achieved 90%. For those of you that were here when I first came on board, this was my goal. And I'm not going to tell you that this is a little delayed, even though it is. Again, so thrilled that we finally got to 90% of Kansas births that are impacted by your work. Huge thank you to all of you that are enrolled and those of you that are still thinking of enrolling. We'll talk about the deadline here in a second, but you are welcome. We are thrilled to, I'm saying finish the initiative, but really what we're doing is finishing enrollment so we can make sure all hospitals across Kansas, all birth words are hard today, birth settings are in fact getting the benefit of the 4th trimester initiative work. Next slide. As an example of a site that has been involved from day one, but also really leads the conversation about trying outside of the box ways to make this 4th trimester initiative work at their local hospital. Christy is on the call. I saw her jump in, and I asked her to just update us on how Citizens Health is doing in Colby, Kansas. Christy, are you on?
Yes. Can you guys hear me okay?
We can, Christy. Go for it.
Awesome. I'm sorry you can't see my face. My office is actually in the nursery because we are so out of room until our new build gets done. So at least you can hear me. That's all that matters. But yes, thank you, Carrie, for the updated little thing you sent out to kind of find out where everyone was at. So that was nice. So out in Citizens, I feel like we are just trucking along, getting everything enrolled out here. Our providers have really been on board with it, whatever changes we need to do. They are very supportive of doing it. I know there was lots of questions on like, how can we get blood pressure cuffs to these moms that are higher risk early on? The cost was such a huge thing, I feel like, for everybody. So we had teamed up with our community healthcare workers over at the clinic. They had gotten a grant. And so being with them and working with them, they are actually supplying all of our blood pressure cuffs for our moms. So we keep them at the clinic and we keep them over here in OB in case we see any of them outpatient and there's any red flags, we can send them home with them. And then our providers are actually the ones that come up with the parameters, the directions, and any like contact information with those blood pressure cuffs. So that's been really nice for us. And then we also teamed up with them on our social determinant of health screening that we do on all moms prenatally at the clinic, and then postpartum discharge. We just made a binder to have contacts that if they, marked yes for anything before they were discharged, we just send our community healthcare workers an email with their account number, and then they do it all from there. So that has been really great.
Christy, that's phenomenal. And I think, as you mentioned, and I see some of our leadership at the state level jumping in on the chat to talk about the fact that now blood pressure cuffs are a Medicaid covered benefit, which is wonderful, phenomenal work. So thanks to those that made that happen. Hey, Christy, big kudos to you. I know that I remember your email, 3 paragraphs of great, great work that you're doing out there. And this is the moment that I wish we had 3 hours to share content, because I know that there's many, many of you doing work like Christy at the bedside. Next slide. But because we're going to keep trucking, here are the things that those of you that are enrolled or thinking of enrolling need to know. Post-birth trainings. Carrie has put together some dates that will be forthcoming. In fact, I think they're on a slide here in a minute, where she is just going to wrap around everybody who's enrolled, sites that perhaps have new folks to be trained, who previously had provided training. So get everybody up to speed, and also for our new sites. If you haven't jumped on post-birth training yet, or aren't sure how to get it done, Carrie's going to do that training in a virtual session or 7 for you. And so 4 trimester sites, the champions will receive that information about those dates. Carrie will work with you to get everybody lined up and how that will go, but it's all virtual, it's all easy, and it's going to be a wonderful way to expand our primary focus in the 4th trimester, which is that post-birth training. Of course, once you're trained, you train everybody you come in contact with, and every patient, every family leaves the hospital with that critical information. Birth equity trainings, next part of our 4th trimester work. Please, champions, please, please, please. I know that KBEN has reached out to make sure that you have started and registered in registered and started in the birth equity training. It is imperative that all champions are KBEN trained before we begin that work in your hospitals and birth settings. So if you got an email from Bernard or anybody at Kansas Birth Equity Network and have not responded to it, I would ask you to do so. We're giving you till October 1st to start KBEN. We got to get this done. It's time to roll into the rest of the state. Go back a slide, Tiffany. And then the big font is there for a reason. So if there are the folks on the learning forum today that are thinking or on the fence about enrolling in the 4th trimester initiative, here's your deadline. October 15th is it, you guys. We want everybody. If we set 90%, why not set 98% of births in Kansas that are impacted? So get enrolled. It's not as hard or cumbersome as you think. You heard Christy talk about some basic and yet hugely fundamental work that they're doing at the local level. You can too. And we know that if we can get everybody on the same page, we will save moms and families in Kansas. So reach out to us if you're interested in enrolling. But October 15th is when we're done with enrollment. And then we will spend the next year polishing up 4th trimester work in Kansas. Next slide. I wanted to bring to your attention that some of the data that we use at the local level as well as the state level comes from PRAM's data. And the link that you see noted there has some great updated infographics that I wanted you all to know about. It's very small print, but there's one specific about maternal depression infographic in Kansas, smoking and mental health, and the combination of risk factors there, and it goes on and on. I could not stop clicking. I think that this is information that for those of you that aren't sure what really are the problems in Kansas that create bigger problems, there's your information. And remember, this is patient information and directed content that came from patients themselves. So really helpful data to use. Next slide. This is one of the infographics that I pulled from that site. And again, wonderful to use at the local level to talk about focused efforts. If you were, for example, working on the vaping question, which by the way is not a part of the birth certificate. And we get a lot of questions at the local level about how to document nicotine use in folks that are vaping, nicotine versus other substances. Good question, right? We've tackled that at the local level a little bit and continue to do so. But an infographic like this, if you look at the bottom, it talks specifically about the cohorts that have increased risks, what those numbers look like related to a college and a high school education, et cetera. Again, fascinating information. Next slide. And then premature deliveries. We know that in Kansas, we've tackled the conversation of low birth weight, premature birth, et cetera. And November, because we will not see each other in October, I wanted you to know this is coming, but November is World Prematurity Month. KDHE has some great an action alert specific, that's the link that you see there, and good information to share out amongst your communities. Again, this is a major focus when we talk about maternal health. Obviously, if we've improved maternal health, we believe that the prematurity disparity will be improved. And these are one of the things that we want to make sure gets pushed out to the state. Next slide. Carrie, again, working very hard to get every local site that's fourth trimester enrolled up to date and up to speed. What we're finding is that you all are making great progress and we can't keep up with all the great work you're doing. It's a great problem. So Carrie created a survey. All the fourth trimester champions should have received it. And it's asking you to update us on where you are under each of the pedals, right? So have you done birth equity training? Where is your hospital in terms of making postpartum appointments prior to discharge, et cetera? We ask you, we beg you to please finish that survey as soon as possible so we know once October 15th is here that we are rolling on through. And then Carrie and I have divided the sites. We're going to work intensively with you to get everybody with all yellow petals on your cute little sunflower that Carrie created. Next slide, please. And this is just always the reminder, if this is your first learning forum or perhaps you're brand new, as the 5 of you that are to the fourth trimester work, we call them projects because each of those 6, I'll call them petals again, that are around the large center there are all of the main projects that Kansas has identified as our initiative work. From maternal warning signs, which is the post-birth work, to mental health, birth equity, postpartum appointments, breastfeeding and family planning. And integrated within that is the importance, of course, of social determinants of health, discharge summary, standardization, et cetera. These are all the things that every site is working on, and you guys are killing it, absolutely doing phenomenal. So when we pull out something like today's learning forum centering around breastfeeding, know that that pedal is connected to many other projects and improving maternal health as you do that work at the local level. Next slide. And a couple of questions. And actually, Tiffany, I'm going to hold off on this so we can get to our featured speakers. Let's add this back into the end. Some great questions have been coming from our fourth trimester champions, which is they need revisited. But let's go. We'll touch base on this at the end of the presentation. That'll also go with that too, Tiffany. Keep on going. And then I just want to show off something to everybody as an example of how far you've come. We started by saying to everybody in Kansas, we have got to fix the postpartum scheduling, the scheduling of postpartum appointments immediately post-discharge. In other words, the idea that you have a live or stillbirth and that we say, see you in 6 weeks is no longer the case. Absolutely not allowable anymore because it definitely impacts outcomes in a negative way. So what do we do about that? Well, we've created a process flow where we talk about what does the patient need, individual level, and when do we schedule that person for follow-up appointments, and how does that work at the local level? Next slide. And I want you to take note, thanks to Carrie with this great visual on the left-hand side. If you look at the third bar over where it says postpartum appointment, back when you all, many of you enrolled in 2021, 135 was asked of you. 1 means we're just starting to figure out how to make postpartum appointments prior to discharge. 3 means we're getting there, we're in process, and 5 means we completed. All, 25, 26 of you in 2021 were just starting the process. And then turn your eyes to the next graph to the right and look at how many of you are now at 5s. Yes, we want everybody there, but look at the shift. Look at the great QI happening and how many are now at the 3 in process, almost there, and how many are at the 5 level. I will tell you, in going through this data again, just this last couple of days, more of you are at the 5 level, and that is huge. Again, you're impacting outcomes immediately with that process change. Next slide. So this is the moment where I midwife you, and I tell you that there is no guilt. We want to do a full throttle finish. We want you to feel supported, but we hear you. And over again throughout our conversations, Carrie and I continue to hear sites say, but we can't do everything. And we're having staffing concerns, or it's a struggle system-wide. We're trying to figure out where to focus our attention. You guys, that's why I showed you the data. You are making change. The fact that you're even talking about maternal health and changing or reviewing your process is a massive improvement in outcomes. So there's no guilt. In fact, just the opposite. We want you in, we want to help you, and we want to make Kansas the best place to birth. And you're doing it. Next slide. Here are the dates that I talked about. So if we mention the conversation of, okay, well, sure, Tara, we're gonna try to finish out strong with this initiative, but man, we're stuck on post-birth or a brand new site. These are the spots. These are the dates and times. And so we'll send those out again to all 4 trimester champions. Get your staff, get your crew to get on virtually. Carrie is a phenomenal educator, and she will do a great job on those sessions to go through post-birth training with everybody that's enrolled. Next slide. And birth equity training. Stormont Topeka did a great job on their own of figuring out birth equity, still doing great work with the March of Dimes to get that entire hospital rocket and rolling with birth equity as part of their work. Hutchinson and Amberwell Hiawatha are currently in birth equity training and should be done soon. Then we'll roll it out to the next sites, and we're really excited for that work. Next slide. Finally, sorry that took longer than I expected, but I appreciate your listening. We know that breastfeeding is a huge component of maternal health in Kansas. I've been asked before, how does it relate to improving outcomes? And I look at that person and I'm not sure where to start. So I don't need to convince the folks on this call about why breastfeeding in Kansas is part of the 4th trimester work, but I do want you all to get an update. Dana Dieters, one of our strong 4th trimester champions, and certainly Brenda Bandy, who is a well-known state leader in this work, are joining us today. So without any further impressive content, I cannot wait to turn it over. You guys jump in. Dana, Brenda, welcome.
Hello, welcome everybody. Yes, breastfeeding is like very, very important to the 4th trimester. You know, when you talk about maternal mental health and things like that we've been working on trying to help those moms, if breastfeeding isn't going well, it just cascades down into mental health issues at times. And so, you know, just for the well-being of the mom, the well-being of the baby, you know, we really want to look at these things and see what we can do to help improve that and to help with the care. So next slide. So yes, you've got me and Brenda talking. I am a nurse at the Nemaha Valley Community Hospital in Seneca. I am also an IBCLC. I was able to get a scholarship to help pay for that training. So for people that are thinking, how do I go through all of this? That is how I became an IBCLC. I am the chair of the hospital section for the Kansas Breastfeeding Coalition. And, you know, like any nurse, I wear multiple hats at the hospital I work at. And Brenda, she is phenomenal in everything that she does. She's the executive director at the Kansas Breastfeeding Coalition. And, She is that cheerleader for breastfeeding in the state of Kansas. And I think we all appreciate everything that she does for all of us. Next slide. So here, you know, basically what I'm going to kind of talk about, a lot of it is like the breastfeeding data, what's going on in the state of Kansas, what's going on across the country. And we're sitting pretty good. Yes, there's room for improvement. There always is. But when we look at our initiation rate for breastfeeding, and you can see where we are, and then the drops, and that's where we start to worry, and where's the supports going out long term, and what's going on, what's causing these drops? Is it because we're going back to work? What is that support system out there? And then, things to look at, like we're ahead of the game in the initiative and the initiation and the exclusive breastfeeding at the 3 months. But then by the time we hit 6 months, we're below the game. And looking at the Healthy People 2030 goals, where they want people to be across the country, we have a lot of work to do in exclusive breastfeeding at 6 months and any breastfeeding at 12 months. So we really need to be working on figuring out, how can we improve this? How can we support these moms? And like I said, is it, are we all getting back to work and that's what's causing it? So is there something that we can do to help that? There are a lot of laws out there that we've been working on and getting going. And it's required that, your job place is supposed to be supportive of these mamas and their breastfeeding. So if that is there and available, are these moms realizing that? Are the workplaces realizing that to support these mamas? Next slide. So then if we kind of break it down and look at further, where we are with just the patient population, with race and ethnicity, where are we going with this stuff, and where are we succeeding? The Asian non-Hispanics really are doing quite well, and so are the white non-Hispanics. But then you can see we start to drop and stuff. So where, when we talk about birth equity, it's, where are we at in supporting the other patient populations, and how can we do that and get those people going better? They've got higher percentages, but we want to increase it all to help all babies. Next slide. So then we look at initiation by county, and this data is coming from what's going onto the birth certificates. And so you can look, we've got a lot of counties that are, at 89.2 to 96.9%. But what I look at, and just kind of counting things out, I think I counted maybe approximately 15-ish counties that are at that 68.9% to 80%. Initiation. And so what's going on in those counties? Are they having support? I look at one that I know is close by to us in Donovan County, and I know that they don't have a hospital to deliver babies. And so if there are mamas living there, where is the referral coming from to go to the people that can be helping them? I know that prior to COVID, we were kind of working on an initiative just up in our area of the facilities, making sure that we send out referrals if we have moms deliver in other counties. And so I know that if I have a mom that is from Marshall County that delivers at my hospital, if they want help, with like the Healthy Start home visit to give extra breastfeeding assistance, that I'm notifying the Marshall County Health Department, or I'm notifying the Brown County Health Department. And so, if these moms are in Donovan County or any of the other counties that don't have a hospital, how are those moms finding out about support beyond even the hospital? And, how are we getting them that support when they're in the hospital to make sure they know where to go once they are dismissed from the hospital, so that we make sure that they are getting that help. Next slide, please. So this kind of divides things out at our breastfeeding rates and the history and kind of where we're going. As you can see, we excel at initiation, and we've seen that in previous slides as well. We really excel at that. Exclusively at 6 months, we were kind of plateauing, and at this point in time, it almost looks like it's kind of a little bit of a downhill slide on that. And then at the 12 months, we're, if we can get the moms to that 6 months, then they are a lot of times probably tending to just continue on and get baby to that 12-month mark, if not farther. And so we want to keep working on, how can we get past that 6 and 12 months? Next slide. The supplementation with infant formula with the first 2 days of life, we are at 16.9%, and the national average is 19.2%. So, we are better than the national average with that. But what's going on? Why are these moms making these decisions to go ahead and supplement with that formula? Or, why is it happening at that hospital level? And is the teaching being done with those moms on that? Next slide, please. So this is something that, I think is very exciting for our state. When we look at live births in a baby-friendly hospital, we are actually sitting quite well compared to the national average. And so I think that's all the hard work, that's gone across the board with Kansas Breastfeeding Coalition, High Five for Mom and Baby, really trying to help support the hospitals and get that out there about how do we do this, how do we get this going, and meeting goals and doing things like that. Next slide, please. So where did some of this data come from? And, where do we go from here? The MPEAK survey is something that the CDC puts out, and it's the maternity practices in infant and nutrition and care. And so if you are dealing with like the lactation side of things and the facilities, we get these surveys yearly typically. And so what it's looking at is, how are we supporting the moms? Do we have the policies in place? Are we having the staff getting their training? What is really truly going on at that hospital level to really say, hey, this is what, what's really going on. Next slide, please. So when we look at the state of Kansas and the results of that, we are exceeding. We're just above that level of the national score, with us having 82 and the national score is 81. But with all of the hard work and of everything going on, like with Brenda and the Kansas Breastfeeding Coalition, we have been moving steadily upward, which is phenomenal. That, we have a lot of people working out there to support those moms, as you can see. And also we have the 8th highest response rate in the nation. So 82% of the hospitals responded to the survey compared to the national average of 72%. So if you are working in a hospital and you see that survey come through and you think, what, does this really matter? It does. And so if you've never filled it out, make sure you fill it out. And if you aren't involved in the lactation portion, because we know bigger facilities, it's intertwined, but bigger facilities a lot of times have separate people going in and helping with the lactation. Go figure out who is filling that out, and figure out those results, figure out who's doing it, making sure it's not getting missed. Because, I know there's been a few times where we've realized in talking with our KBC calls that people are missing it, or it's kind of coming through kind of funny, to realize who it's actually going to, so that people know throughout the hospital, hey, if you hear anything about it, let me know so I can get it taken care of. Next slide, please. So now we start kind of dividing things out and looking at ways to improve. And so this, some of this stuff does come down to, what are we doing in those delivery rooms? What are we doing in the operating room if there is a C-section? And so a place that is a lower score is that the newborns are remaining in uninterrupted skin-to-skin contact for at least an hour until breastfed. And so when is that baby getting to that mom skin to skin after a C-section? And we recognize that in a C-section, sometimes moms are not always in the state to be holding that baby. And so when is mom ready to hold that baby? And, where are we getting the skin to skin? Are we starting skin to skin with the father until the mom is able to, and trying to do that? And even if mom is choosing to formula feed, are we getting the skin to skin done? Because we recognize the importance of that and how it helps stabilize that baby with the breathing, with the blood sugar, all of those things, that it just helps those babies if they are up next to their mama, getting that skin to skin contact. Next slide. So this is another big thing, that, it's very obviously something that needs a lot of work. And so it's those routine newborn exams, procedures, care, a lot of that stuff can be done in mama's room, and that baby can stay rooming in, and be available to breastfeed as needed. But a lot of times, we're finding the survey point blank, says this, but that, we're bringing the baby out to the nursery to do exams, to do a hearing screen, to do vital signs, to do a bath. And when we could be really trying to focus on doing those things in the mom's room. And if we, the thing is, we keep working on this, and that really improves our score, because that's something that I think really pretty easily could be done. It's just ensuring that staff know, hey, do these things in the room so that we can improve our care and make sure that that baby is there ready to feed when it is time. Next slide. Thank you. And so now we move on to looking at those babies receiving formula. And, the big thing with looking at this, we have quite a few breastfeeding newborns receiving formula. And so, in all the talks with the KBC meetings and things like that, why are we doing this? What do we need to do? Are the parents wanting it? Are we doing education on what a baby's feeding habits are, that they tend to cluster feed on that second night, or they're going to go through a sleep cycle and then they're going to wake up and really want to eat off and on for an hour or two straight? And how do you deal with that? And how do we help those parents through that? Is the doctor saying feed the baby? And so do we need to talk to the doctor and say, hey, we really shouldn't be doing all of this formula. What are we doing to help with that? Another thing, and so this is something that is becoming a lot more prevalent that would help, is figuring out how to have that donor human milk available to use instead of formula. And sometimes I know, like for the smaller hospitals, okay, how do we hook in to get that donor milk? So, we don't have a large volume of deliveries. We don't want to waste it. So how do we get that to be able to help those moms? So that way, if we do need to supplement that, we're using breast milk, and getting that going for those babies. Next slide, please. And so then the next thing is really just making sure that the education is happening, and how to help with that latch, how to help with that positioning, how to make sure that, the baby's feeding effectively, how to hand express milk. And so this is something where I know we've been, really talking about education to the other staff. Yeah, you can have an IBCLC at your facility, but are they there 24/7 to help? Because that's just not always feasible in some facilities. And so making sure that those nurses that are going in and helping those moms, that they know how to assist those moms. They know how to teach those moms, okay, what does this latch look like, that it's a good latch? Are they sucking good? Teaching the moms, how to observe the feeding patterns, or how to know what they are, and also to know what their elimination patterns are, so that moms aren't freaking out going, well, we had a whole bunch of diapers kind of at the beginning, and it's day 2 and 3 and we're not seeing as many wet and poopies. What's going on? Am I starving my baby? Being able to teach those moms, this is okay, this is normal, this is what to expect, and everything. Latching, to me, positioning, just being able to show moms different positions, being able to show those things. Hand expression is something that, unless you've really been taught how to do it, it's kind of a tricky thing to figure out. And so showing those moms how to hand express to be able to get that baby to latch on. Next slide, please. So then the discharge support, that is another big thing. We talk about, okay, we're sending these moms home. What are we sending them home with? Are we sending them home, even though they're breastfeeding, are we just automatically sending them formula home with them? Are we sending them nipples? Are we giving them the formula company diaper bags, those samples that those formula companies want you to be giving out to promote their product? And so, looking at your facility and saying, okay, yeah, we are giving that stuff out to every mom. And I know that the formula companies aren't charging for that. They want their names out there. But we need to step back and say, okay, we're not going to give those things out because, all right, well, we have this mom that's kind of on the verge, doesn't know, and then we just send it home and it's an easy way out. Instead, we need to focus on the education side of things and telling these moms, okay, this is what we do when we have these feeding issues and things. And so, taking a look at what handouts are you giving out to these moms when they're leaving the hospital? Is it stuff that's promoting the formula and things and stuff? And other things just to look at. What's our discharge support looking like with these moms? Are we scheduling things? Are we saying, okay, you need to see somebody with lactation within a couple days of going home? And how are those appointments set up? Is lactation coming in and scheduling them? Or is it just the patient's supposed to be going and scheduling something with lactation? Things that, like, a neat thing that we do here is, I automatically see everybody within a couple days of them going home. And I know a lot of other facilities are doing that as well, because a lot of facilities have breastfeeding clinics or things like that. So just making sure those things are scheduled and everything before those moms leave those doors, making sure that, are we seeing good breastfeeding before they're leaving? And what do we do if we are having troubles, how, teaching those moms, okay, we're having trouble getting a baby latched. How do we wake that baby up? How do we get that baby to latch on? Education is a big thing when it comes to that discharge support, because otherwise they're going to go home and it's going to be a very rough time for them. And so we would just want to make sure they are prepared for going home. So next slide, please. And so it all comes down to management. Where are we at with our policies? Are we getting the nurses trained so that they can assess the breastfeeding, so that at 2 a.m, if that baby is struggling in the IBCLC or the CLC isn't available, how do those nurses in the middle of the night help besides, okay, let's just put a bottle in the baby's mouth and let you get back to sleep because we know you're point blank exhausted, so that the staff knows how to help. On the flip side, sometimes all moms can't breastfeed. And so if they have to formula feed, are they being educated on how to properly mix their formula and how to feed that baby formula? Because we still do ultimately want to make sure that baby is taken care of. So I will have moms that will formula feed, and I will still go in and I will do education on them. How do you mix that formula properly? Because we want to make sure those babies are staying safe. And so then, are you tracking things? Are you keeping track of your breastfeeding rates? Are you keeping track of what's going on throughout the entire hospitalization? Other things to look at, are you getting the free formula from the company, or are you paying the fair market price for that? Because it's very easy to just take that formula in. And sometimes for a smaller facility, it is more cost effective just to get it given by the formula company, because you don't have large volumes of it even just going out the door. And then the big thing that we really need to work on is making sure that our hospitals are getting the policies all squared away, so that, okay, we've done all of this to make sure that we're in line with what we need to be doing to help these moms. So next slide, please. So checking your policies, making sure all of these things are all in line with what we're doing with, if we're having to give formula, why? Are we assessing what the staff, what their training is? Are they competent in helping those moms? Are we talking about that the moms are being, given information on breastfeeding in advance? And are we looking at our formula, the substitutes, all of those things? Are we providing resources for those moms? Are we doing the skin to skin? Because that really helps get the breastfeeding going. And then are we allowing those babies to stay rooming in so that we get that baby fed right away? Or are we hauling the baby off to the nursery any chance we get? Next slide, please. So here are a lot of resources. You can click on those links. You can kind of see what the report was for the state of Kansas, what the scoring algorithm is, and what the survey questions were. So you can kind of know what you're looking at if you're going back to your facility and saying, okay, I need to assess this stuff and see actually kind of where we are sitting. So you can kind of look at those resources. Next slide, please. So there are some quality improvement programs that are available to help the staff, to help the hospitals get these things going. Next slide, please. So High Five for Mom and Baby. We have that in the state of Kansas. That's up and going. And basically what it does is for those facilities that are not quite there for baby friendly, that they give you, you can at least meet some of the guidelines. And then they're also there for support to help you get to that baby friendly status. Because if you're not familiar with those things that you need to do to get to be baby friendly, they help you with all of that. And it basically has to do with everything that we just talked about to support these moms. Do we have our policies in line? Do we have staff competency? Do we have lactation support? Are we educating the moms? Are we making sure that the skin to skin is happening? Next slide, please. Are we giving individual care? Is somebody coming in and doing the teaching with the moms? It sometimes gets rushed in the day and you just bring the baby in and here, feed the baby. And so are you able to find somebody that can spend a little time? Because sometimes it does take a lot of love and support to get those moms feeding those babies. And sometimes you're standing there for a half an hour working and trying to cheerlead and help those moms. Making sure that we're not doing any other food or drink besides the breast milk, doing all of the rooming in, and making sure those moms know those feeding cues and when they need to feed the baby, regardless of a time frame. Next slide, please. And then making sure we're not doing any extra pacifiers or artificial nipples, because that can really impede on the breastfeeding. And then just really making sure that there is support in the community. And so when those moms go, they know, okay, I can call this person if I need help, or I can reach out to that person. And so those moms are just aware of all of those things to help them to continue on. So hopefully we can make our numbers better for the 6 and 12 months, to keep that breastfeeding going. Next slide, please. Other things on the High Five for Mom and Baby website, there are practice sheets. This website has a lot of great resources. And so you can get on there and look at all kinds of different things to help with meeting those guidelines and the policies and everything. Next slide, please. And so then Kara Gerhardt is the coordinator for High Five Mom and Baby. And so now these are a bunch of the facilities that are all High Five facilities. And so as you can see, there's a good list there. Next slide. And even more. These are the premier groups, or these are the ones that are just taking things to the next level. And so as you can see, there are a lot of places in Kansas that are really working hard to support these mamas. Next slide. And then this is a big thing that is exciting for our state is we have a ton of facilities that are baby friendly. And that I know there are more that just keep on working towards that status. It's very stringent and it is a lot of work to get to baby friendly status. I know that those facilities put a lot of work into that. Next slide. Empower is another thing, and that group helped do a lot of training to help with the staff training, which is sometimes the hardest thing. And so this allows you to kind of get the staff trained. It has training materials, tools, resources to help those hospitals build that competency-based training plan. So these are facilities that did the Empower practices. Next slide. So now I'll kind of turn it over to Brenda. And so that way she can talk more about the Kansas Breastfeeding Coalition. I know I've done a lot of talking about things, but she has tons of stuff and the KBC is phenomenal with a lot of great resources. So I'll let Brenda talk now.
Great. Thank you, Dana. That was a fantastic overview of the quality improvement and the data and a deep dive into that MPINK survey because we know ultimately that improves practices for how we care for families. So some of you may have been taking notes and wondering, how can I do that? Or how do I work on that? All the things that Dana mentioned. So I just want to wrap us up here. Where are the resources to help you improve your breastfeeding support? And I think at the top of the list is the Kansas Hospital section that Dana leads. They meet every other month online, and they are really a support group for you all. It is a support for hospitals working on breastfeeding support, and it's also sharing of resources. You might be thinking, how do I get a donor human milk policy in my hospital? Where do I get donor human milk? These are the questions that come up in the hospital section conversations. We also create resources as well. A discharge protocol is something we're working on right now. In the past, we did the medications algorithm that you may be familiar with and the impact on medications and lactation. So creations of resources and lots of questions being answered and resources being shared. Next slide. There are also hospital resources on our website. We have a hospital page dedicated just for you, and it does have quite a bit of the information from High Five, but it also has information from around the country on other trainings that might be available, and you can see what all is there. So there's policy libraries. We also, if you're looking closely at the slide, see that third bullet point? A billing cohort. Yes, we just figured out in April, we started a billing cohort. If you're interested in figuring out how to bill for outpatient services, please email me and I'm happy to add you to that. They meet every month on the second Monday. And again, lots of sharing, lots of questions being answered. Next slide. General resources, we have a lot of those. I won't go over them, but there's that medication and lactation that came out of the hospital section. Next slide. And our conference coming up in Wichita the week after the other conference. So just stick around, do conferences all month long in October. We would love to have you join us. Just an overview on Thursday, October 26th, it is a clinical day. It's a deep dive into hot topics in lactation. And we're going to have, as you can see, a lot of information there about non-birthing breastfeeding. And then on Thursday, we are doing our Community Day policy, systems, and environment discussion. So we invite you to join us for that as well. as well. And I think that's it. Next slide is just our contact information. And also a huge shout out to Kara Gerhardt. For those of you that are not involved in High Five or want to step up your game to the premier level, please reach out to Kara. Thank you for having us.
Thanks, you guys. That was great to hear. I'm thinking back 10 years to where breastfeeding was just taking off, maybe 15, Brenda, and how far you guys have come. So congratulations. And Dana, again, we know you're a champion in many ways, but great work. Next slide. So we're going to actually offer again our conference. That's the QR code to register, and you all will get the slide deck in the next day or so from Tiffany. So again, use the QR code to share out and also to register. Tiffany, if you could go back, and I wish I could remember which slide it was, to the common questions. If you are not a 4-trimester champion, you are certainly welcome to stay, but you do not have to. We're going to spend a few minutes that are left over going through those questions for those guys. And for those of you dropping off, we really, really look forward to seeing you in October at our conference in Salina. We will come back in November to another learning forum and look forward to seeing you there. So for those of you that are still on the call, that are 4-trimester champions or hospitals with some very common questions, here are just a few things that are coming my way, and I wanted to answer them. Carrie is also on the call if there's some things that she wants to jump in on, and certainly we'll open it up for questions at the end. Two different sections with education. So when we talk about data, for those of you putting data into QHI, and QHI, remember, is how we're collecting data at the hospital level regarding 4-trimester work. So when we put the data into QHI, there are two different sections related to education. And this question came regarding, where do I list the number of staff that listen to the class? If you, for example, held a 4-trimester meeting or a meeting of any kind regarding 4-trimester topics. And in this scenario, she was mentioning mental health and substance abuse screening. So your unit or your hospital held an educational session regarding mental health or substance abuse. This champion wanted to count that, which is correct, under 4-trimester education within the QHI. There are two spots that would count, that would need to be collected. One is the P1A, inpatient outpatient care provider collaborative education, and P1B, and I'll show you those specifics in the next slide. Actually, Tiffany, can you pop forward to that next slide? Yep. So you see the first two arrows are pointing to shared learning experiences. So let's say this month, if your hospital has 5 people on this call, right? We want you to count that. And so again, you would count it in P1A there, where it talks about collaborative education. The question that champion asked would also go there. And then this P1B is asking how many care settings are represented. So let's say on the call today that you have, or at a meeting, you have representatives from postpartum unit, from emergency department, from social work, etc., outpatient clinic. Each of those sites or each of those agencies or each of those units within your hospital setting would count under P1B. We get a lot of questions about the difference between P1A and P1B. P1A is number of people. P1B is number of sites or units or departments that are represented at those educational sessions. But again, all work regarding 4-trimester topics counts. And please, please, please give yourselves credit for that. Tiffany, if you'll go back one slide. So postpartum visit template. We will be sending out the postpartum visit template. As a reminder, we talked about this when we were on site last spring, that there's the comprehensive postpartum visit template that ACOG created. We ask you to send that out to all of your outpatient facilities and sites that conduct postpartum visits. All you're doing is sharing the latest ACOG recommendations. You're not forcing their hand. You're not collecting data on how many of those visits they actually do. You're just sharing that out with those outpatient clinics. So we'll be sending that out again via email to you all, that template, and perhaps with some language that helps you get that information into their hands. And then that would count as your checklist item on that part of the bundle. And again, that's also in the QHI question list. What are people doing for ED screenings, reminding staff? So if you remember the conversation within the fourth trimester that just asks, is your emergency department asking the question, are you currently pregnant or have you been pregnant within the last year? That quote universal question is what we're asking all emergency departments across Kansas to begin as part of their protocol. We want all fourth trimester sites to work with your emergency department to embed that screening question in their triage. So again, that's all we're asking of you is to work with your emergency department and to get that question started or embedded. And once you do that, then again, the answer would be on this date, they started that triage question as part of their protocol and get credit for that part of the bundle as well. And then debriefing, we're going to answer that at a different day. That's the question about patient debriefing. And then social determinants of health. So the respondent is asking if social determinants of health screening happens before they're admitted to the hospital or during their hospital admission, does either of those count? And the answer is yes. If a patient has been screened for SSDOH prior to admission and that follows through on her admission, in other words, you can see that information, it carries through, doesn't mean you can't revisit it during her stay. That'd be great, but it does count that she's had that screening done, and certainly any resources that we need to add to or continue post-discharge would be important. So again, that would count as that piece of the screening. So with that said, we're going to let you guys go for the day. I appreciate everybody's attendance. Let me stop and ask. I guess we have 4 minutes. I was in a hurry for you. Any questions? Jump on the call and ask regarding fourth trimester work. If not, we'll let you guys enjoy the rest of your lunch hour for just 4 more minutes. And we look forward to seeing you in October. Thanks so much, everybody.